Dr. Majken Højrup. Welcome again to UroChannel. We've been doing a show in May. Congratulations to your PhD.
Thank you.
We watched it yesterday and you did very well. And you did a PhD on Peyronie's disease.
True.
But we're not going to talk about Peyronie's disease right now because you did something new. Because you moved from your clinic to your own clinic, so you are working in a separate space now. And we were talking about that people can't come to you, but now they can. So maybe you want to tell us a little bit about your new endeavor.
Yes, that's true. I stopped at the hospital to do a private practice, and I'm so happy I did it. I wanted to do more in sexuality, and to do so, I had to go on my own. So now patients with problems in sexuality or sexuological problems can book an appointment with me. As a private, they will have to pay for it, and they can go to my website and book the appointments. And what I help with is reduced lust in both men and women. It's erectile dysfunction, Peyronie's disease, and ejaculation problems, whether it's too late or too soon. And in general, issues or worries about your sexuality. So it can also be younger people who are in doubt whether they like the opposite sex or the same, or how can I define myself or find myself. And I'd also like to be sort of a site for information if you are in doubt. Is it normal that I think like this, or is it normal that I look like, and all these sort of questions.
I think many people are not quite informed what a sexologist is, and you just touched upon it, because I used to say I'm a sexologist because I am a sexologist, so I'm trained in sex therapy, but people don't really understand, so now I'm saying I'm a specialist in sexual health. But being a sexologist involves the psychotherapeutic part, right? And this is what both of us are doing. So can you tell more about it? What is your approach when somebody comes to you with problem in sexual desire? What do you do?
Well, it's difficult to say in general what I do, because it depends on what is the trigger to have reduced lust. But it can be several different things. First of all, having reduced lust is very important to figure out whether it's reduced lust too earlier, or is it just compared to your partner, compared to your neighbor, or what you think you should have more lust. It can be different times episode in your life that gives you reduced lust. So it's not necessarily wrong.
Mm-hmm.
So first of all, we need to figure out whether it's actually a problem. Then if the person, him or herself, thinks it's a problem, we can try to reveal what the base of the problem is. Sometimes it's due to biological things, but it can also be due to psychological things. And I try to look at all of the sexuological problems in both their biological, psychological, and social ways, because I think they all are important and they can play a part whenever there is an issue.
And there's especially a problem with men, because we, culturally, we talk about problems with sexual desire in women. Nobody really cares about men, because men, sociologically, they are supposed to have lust or sexual desire anytime, any place.
Yeah.
And this also makes it a taboo theme for men, because they are ashamed to go to somebody and talk about their problems. And then if they go, they very easily think, well, this is a very easy solution to that, because now it's testosterone we're talking, right? So everybody's talking about testosterone, this super hormone. But in my experience, in fact, it's very important for men. And if you don't have it, it's a problem. But it's not that super hormone in a sense that if you just substitute and go until a certain level, that it will change your life completely. So I have many men coming to me with problems in sexual desire who have normal testosterone. So testosterone is not the solution. So it's not that mechanistic. You say, okay, we could just give you testosterone, then everything will be all right. Is it your experience as well?
It is. And some men you can explain, and others are very focused on that testosterone is the only solution, and you will never really seem to agree, if you could say it like that. But some men, when you explain the function of testosterone, what will happen if you add it, what are the side effects, and why, when you calculate that it's in the normal range, why won't you benefit from adding more?
Mm-hmm.
And some men, if you actually explain the whole physiology in testosterone, what is the pros and cons, and also what other things in life can reduce your lust. A lot of men actually do understand and say, well, if that's the case, I don't want testosterone. So, doctor, what can we then do? Mm-hmm. And then they are motivated to look at other courses for their low desire. But I agree that some men are very like, my car doesn't work, I take it to the mechanic and they fix it and then I'm off again. And they have sometimes the same feeling with their body. I know there's something wrong, and they read an article and it can be testosterone. Right, doctor, fix it, and then I'm off on the road again. No? And I think it's that mechanism, and also partly because it's simplified and it's nice to call your reduced lust a name. Mm-hmm. It makes it simple in your head. And also then, if it's true, well, then there's an easy solution. Why not fix it? And all the other courses can be more like, well, maybe not. And so it's important to have a very good talk with them, and also to explain what the many issues that there are with testosterone, because I also think it's a phenomenon that's up right now, and it's modern, and it's up in the time that women have menopause. So what do men have? Don't we substitute? Do we not need to? Mm-hmm. And it can be also the society of that you have to be young forever and you must keep up with everything else in life. And then they've had focused on the testosterone as well.
Yeah, male menopause is a big theme. It's a big topic also on the internet. Yeah. And I see it occasionally. And there are men who have low testosterone and who come to the office with all the symptoms of low testosterone, and they are really helped, but not all of them. And if you measure them, I think there's not a good correlation between level of testosterone and symptoms. Very often they have low testosterone and they don't really have the symptoms, and sometimes they have the symptoms and testosterone is normal.